So, Commissioner, just first and foremost, want to get your reactions to this outbreak in Texas, that one death, the first one, I believe, in a decade since 2015, I want to say. I guess, what's your reaction just to hearing that news?
This is very sad news. It's terrible when anyone passes away from a preventable disease. And one of the things I think people are missing on the Texas outbreak in particular is almost 1 in 4 people are ending up in the hospital from measles. And I think this is one of the things that people forget is measles is not a harmless childhood infection. Measles is a serious disease. It is one of the most contagious diseases any human can have. The only thing about measles, which makes it a little different, is unlike other viruses, when you get measles, you have this thing called immune amnesia, where your immune system kind of forgets to work for a couple weeks or a couple months or even longer for some people. You almost have to think of it like a hard drive. The immune system has to reboot itself, and it will do that eventually. But this is partly why people do have problems with measles and then other illnesses down the road. And Sam, just to give a little global perspective on measles, this is not just a Texas problem, it's a global problem. Over 100,000 people die last year from measles. Some of the problems in the other parts of the world is access to the vaccine. That is not the problem in Texas or New Mexico or Canada or New York. We have no problem with access to measles, mumps, and rubella vaccine in the United States.
Texas, I believe, was already in the hundreds and it's only 2 months in. I guess just from that perspective, how worried are you about, in the future about a potential measles outbreak?
I am worried. And I think one of the things we have to worry about in New York in particular is our vaccine numbers are not where they need to be. One of the benchmarks I look for is the percent of children by the age of 2 who've had their first measles, mumps, or rubella vaccine. I need that number to be over 95%. Right now, that number in New York is 81%. It's much too low for the most contagious disease to humans. Another metric I look at is the percentage of kids going into kindergarten who've had both measles, mumps, and rubella vaccines. I need that number well over 95%, and I'm just under 90%. We're vulnerable in New York. And I think one of the things we have to ask ourselves is why are our vaccine numbers for one of the safest vaccines out there so low? I think the answer is there's too much misinformation about measles, mumps, and rubella vaccines. And I worry about the misinformation that, quite frankly, is all over people's phones and all over their lives every single day.
I guess going off that point, for those people who I guess maybe don't have that trust in the public health system, maybe don't trust pharmaceuticals, don't trust, I guess, government, how do you work on, I just speaking to those people and what would be your message to them when it comes to taking this measles vaccine?
I think it's important to ask yourself when you're getting any information is the source believable and is the source credible? Are they really an expert? I'm the state health commissioner. I have no hidden agenda. I wake up in the morning, go to bed at night, and everything between. All I'm concerned about is your health and well-being. That's it. I have no other agenda. My only agenda in life is to keep you healthy. I think it's important to think, why am I listening to people who aren't experts? And when you look at these conspiracy theories, sound a little bit too good to be true, sound believable, but they're often very false and very misleading. And this concerns me deeply because there's so much misinformation people consume every single day. I think also you talk to your doctor. I think it's really important to have a relationship with a doctor, understand what's going on, ask them their opinion. I've been a pediatrician for over 35 years. I know how good these vaccines are. I know they're the best protection you have out there. I understand that. I understand the science extremely well. I'm an expert in this. There's a reason why I'm an expert. I studied long and hard to understand these concepts, and I'm highly incentivized to make sure you get the best information.
Now, going back to what you said before, you said you want a 95%. Was that the 95%? So is that herd immunity if everyone gets 95%?
Yeah, so when we're talking about herd immunity, what that means is if more than 95% of the population gets the measles vaccine, then you're really likely that no one will get measles. And keep in mind, in the United States, measles was declared eliminated in the year 2000. I think it's really important to understand it was eliminated in the year 2000. And right now in the United States, we're on pace. If things keep going the way they are, we'll be one of the top 10 countries globally with measles. across the planet. That would concern me. It should concern everybody. More people need to be bothered by the low immunization rates. They really do. It's really becoming a very significant cultural problem in the United States.
There have been 4 measles outbreaks this year. In this country last year, there were 16. So it's not unusual. We have measles outbreaks every year.
U.S. Health Secretary RFK was asked about if he was concerned about the outbreak. I believe he mentioned that there were 16 last year outbreaks, and this year there's only 4 outbreaks. So he seemed to not, I guess, be as concerned. I guess what would be your response to that comment?
I'm concerned about the outbreaks of measles in the United States. Everybody needs to be concerned about this. It is the most contagious disease that humans can be exposed to. This needs to concern everybody. This is a legitimate public health threat. And what's tragic about what's going on in Texas is this is completely preventable. Underscore, completely preventable. More people need to be bothered by things that are completely preventable because there is something we can do about it. Vaccine availability in the United States is not a problem. Everybody can access it.
And I guess just looking forward, what actions are you taking at the state level to raise awareness, or just any actions, in light of the outbreaks that we're seeing across the country?
One of the things I did that released in our press release this morning is, I gave you a link to a public service announcement I did. If you can invite me into your living room for 39 seconds, I have a message for you. Other things I've done is I sent a health advisory out, not just to all local health departments, but all healthcare providers across New York State, telling them how to recognize measles, how to test for measles, but just the importance of that solid recommendation of the vaccine for you regarding measles. We do a lot throughout the year to make sure your healthcare providers are prepared to give you measles, mumps, and rubella vaccine. We make it available to them. It's really important that people understand we are doing our part. All I'm asking people to do is please listen to experts when it comes to making your choices about vaccines. Please be very thoughtful about who you're listening to.
And just curious, would there ever be a scenario where the state could issue some kind of vaccine mandate to help get to that 95 immunity number? Is there any kind of talks of that or any discussions there?
So immunization for measles, mumps, and rubella vaccine is required. And we do investigate that and enforce those requirements. But that's only by the time kids go to kindergarten. Now, you might say, why aren't we at over 95%? Not everybody goes to school. And so this is one of the things that the Department of Health does is we actually audit schools and we audit records and we ensure that the kids in the schools actually have the appropriate number of vaccines. One of the things about New York is we're different than Texas. We don't allow religious exemption for vaccines. Part of why Texas is in the problem they're in is they've allowed a religious exemption to a vaccine. This is why they're in the situation they're in right now. The measles, mumps, and rubella vaccine, it's the best protection out there. Very safe vaccine.
And I guess just going back to New York, I believe so far 2025, there are 2 reported cases. I believe they're both in New York City. None, I guess, outside of New York City. Any concerns at all that upstate New York, just due to the close proximity, the capital region, may see an outbreak in measles, just maybe due to a rise in cases in New York City?
So how you see measles usually in New York State is usually it comes from a travel experience. Someone traveled to another country, they acquired measles. Keep in mind, you won't show symptoms of measles until 7 to 14 days after you were exposed. They come back to New York and then they expose everybody around them. The communities I'm most concerned about are those with the low immunization rates. Some of the communities in New York State are in the 50% range. Some of those are in the northern or western part of the state or upstate. Some are just north of the city. We have some very vulnerable communities. So I do worry about that. And this is really why it's so important for people to look at their personal issue. Have you up to date your children with the measles, mumps, and rubella vaccine? The first dose is 12 to 15 months of age. The second dose between the ages of 4 and 6. If your children aren't up to date, you need to go to your healthcare provider and remedy that situation today.
Besides encouraging folks to get vaccinated, are there any other actions that you guys are looking into or taking just in light of the recent outbreaks?
Part of why we did a public service announcement on measles, mumps, and rubella vaccine is try to combat the misinformation. And, we'll do this from time to time where I will speak to the public directly. It's one of the things we're doing here. And I think it's really important that we look at the world we're living in right now, it's really important to me that people in New York get credible information from a trusted source. My only interest is protecting you. I've been a pediatrician for 35 years. You know, I've given the measles, mumps, and rubella vaccine to tens of thousands of children. They've lived long, healthy, happy lives, and they haven't had to deal with measles. I've never had a child who had the measles, mumps, and rubella vaccine who got measles. I've never had a child who had the measles, mumps, and rubella vaccine who had a serious adverse effect. The measles, mumps, and rubella vaccine doesn't cause autism. That's proven. I have 3 kids. 2 of my kids have different forms of autism. They didn't get it from anything other than just genetics and just the way life is. You know, and I think it's really important for people to understand is that this is something I do for my own kids. I vaccinated my kids. I vaccinated all these patients. I've seen nothing but wonderful outcomes.
If you had a message and you were able to say something to Health Secretary RFK Jr., what would that message be?
You're running the largest agency in the US government. You touch the lives of every single American every day. You have access to a microphone and you have a voice. You should use it. I think it'd be wonderful if the secretary would just remind people of the importance of the measles, mumps, and rubella vaccine, particularly with his history. I think him using his voice to give that message would have impact with people.